So as far as the actual way that the decompression works, so here's what happens, all right? If we're looking at your lower back or your neck, it's the same thing. You've got bone, disc, and bone, and then the spinal nerve, okay? So the two most important things with the disc is this. Number one, the inside part of that disc is made up of a water and a jelly-like structure, okay? And what happens over time is that disc can slowly compress as the water through life, we start having less of it and or we get injuries. We have less water, which causes the disc to compress, and eventually that little disc pushes up on that nerve root, and then we start having the pain, whether that's in our neck, right, our shoulder, down our arm, down our leg with sciatica, but it's all the same as far as what causes that pain. The second thing is the disc is avascular, right? There's no direct blood supply to a disc. If you cut your finger, it bleeds and then it heals. But the discs don't work that way, right? The discs require proper motion, meaning all day long when you're bending, twisting, turning, looking up, looking down, the discs compress just a little bit and then they open. Right? And this motion, it's called spinal imbibition. Think of it like a pump. And the pump is going to deliver water, oxygen, and nutrients to that disc so it stays nice and healthy. But the problem is when patients come, is the disc is in a compressed state, which is number one, causing that pain, and number two, causing that pump system to no longer function. So now that disc isn't getting water, it's not getting oxygen, it's not getting nutrients. So it's going to be really, really difficult, if not impossible, to heal. Okay. So what the decompression is doing is two main things. Number one, it's comfortably and slowly decompressing and pulling the disc off of the nerve root. So number one, you start to feel better, but equally, if not more important, allowing the disc to once again receive the water, the oxygen, and nutrients, so we can then go ahead and heal up that area, get rid of the pain, and then through some of the rehabilitation and stabilization protocols, keep it that way, right? So we don't want to then obviously recompress and just be up and down with the pain. And that's how it works.